Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more.
Hello everybody, I am the Millennial Mechanical Therapist, and today we're going to talk about the importance of patient education. So I know that MDT isn't the only thought process or school of thought that really drives home the need for patient education, but they do it so well that I have to bring it up. And this is, and I have a perfect example from a patient I just evaled about 2 days ago and had the follow-up with today. So patient education is huge in the McKenzie system, and we talk about things to avoid, postures that may be good, bad, the need for multiple repetitious loading if it's something that responds to repeated movements, static loading if it's something that responds to static movements, static positioning. And we do that so well to help patients avoid things that could be causing deformation of the tissue and doing things that could be causing healing of the tissue more, and trying to balance that out, or at least give the better an upper hand, so to speak, no pun intended there. I saw this gentleman 2 days ago, and he came in with a kyphotic deformity. If you don't know what that means, he's pretty much stuck in forward flexion. He has pain in bilateral legs going down to the knees and in his low back, and he was concerned, not even because of his kyphotic deformity, because of the pain in his legs. When I approached him about his deformity, he said that's something that's been getting progressively worse within the past year or so. And he previously spoke to about having pain for, I believe, about greater than 10 years. If you can imagine, at the point in time when you have a kyphotic deformity, usually things that feel better are sitting and not moving. You know, accommodating to that huge deformity is things that are making him feel better. He feels worse with movement. However, the more he walks, the more he moves, the better and better and better and better and better it gets. But it takes a while to get there. And he even showed me within about our eval, or the history taking, the subjective portion of our eval, took maybe 15 minutes. And he showed me that as he stands up, he kind of reversed his curvature as he kept walking, kept walking, kept walking. Now, he didn't get to straight or to vertical, but he got straighter. And he said that his symptoms correlated with that. So I did what I've been taught, and I put him over pillows, first accommodating for the deformity and progressively pulling pillows out, pillows out, pillows out. And we were able to centralize his pain, but it was very, very, very painful. So the majority of my eval really was educating him on postures to avoid, postural correction, to be trying to do pretty much lying prone and prone prop until he can perform a press up. That unfortunately, having this big of a deformity really puts him in the time frame for it being longer, his rehab taking longer than normal, longer than I personally like, and so on and so forth. 2 days go by and I see him today, and he comes in with this big grin on his face. Now, he still actually has a little bit of the deformity, but he does look better. He does look better, and that's not me just wishing. He even said he feels taller, he's walking better. If he does have to bend down, he's bending down and able to come back to vertical much, much quicker. So he's saying all the things that I want to hear on day one. We're thinking that we have the location right. It's definitely his spine. We have the direction of preference right, otherwise he'd be worse, or at least no difference. And the force is probably the best that we're going to get right now anyways. So what he says to me that truly just sat with me, it sat well, and really just made me want to do this right now. I literally got done with him. I'm ending my day and I'm talking to you about this because he made me want to do this. He said, I've gone over 10 years with back pain, or with pain in my legs, around my spine, and I went from doctor to doctor to doctor, and all they did was throw medicine and other types of things at me. I've been to multiple chiros, and nothing has changed. Maybe for 10 to 15 minutes I felt better, but nothing greatly has changed. And no one's even explained to me what the heck is going on. And then I walk into your office, And not only do you break down everything to explain to me what's going on, you explain to me why I need to do some things, why I need to avoid things, why some things have been worse in the past and better now. And he said, I just can't thank you enough for explaining this to me and giving me power. And I loved it. I shook his hand. I gave him a high five. I loved every second of it, because education is power. It is truly power. The non-educated patient will not respond quickly because they can't. If they don't know why they're doing it, how to do it, and what to avoid. How can they respond quickly? Regardless of how good their mechanics get, if they don't know what's going on, how the hell can anything get better? Patients need to be empowered, and that is where the McKenzie system is huge. This gentleman will not be someone who I see in 5 or 6 visits. He's probably going to be here for a while, and he's working for it, but he knows what he's working for, he knows the goal, and he knows why. And he's going to be phenomenal. He's going to end up doing just fine. No, I guarantee it. He's going to be just fine. He's going to do well because he has power. He's got all the power. I can't do anything more for him besides help him along his path now, because he has it all. He's got all the pieces. He's got all the pieces on the board. He's winning this game. That, my friends, is another reason why I love mechanical diagnosis and therapy, because you give these people power. You change their lives by giving them control over a situation that they seem to think is out of control. You give it to them, and you can sit back and watch them grow and win. And how great is it to be able to look at someone and just watch them winning because of something that you just educated them on, that you taught them on, and now they go and live this life of being better, of working harder, of getting their goals, taking them down, smashing them, just because you simply took the time to educate. That is huge. I don't know other systems that are doing it as well, and I'm not going to harp on who is and who isn't. All I know is mechanical diagnosis and therapy. If you're doing it the way they show you to, the way they teach you to, you're going to have patients like this. You're going to have patients who kill it simply because you educate, who do awesome simply because they avoid provocative factors. That, my friends, is awesome. And that makes me enjoy this Friday. I hope you enjoy Friday, or whatever day that you're seeing this. I thank you for visiting with me, as always, and I'm going to leave you with move your patients early, move them often, and move them to end range, because that's truly where the magic happens, my friends. Follow us on Facebook, Twitter, and Instagram. Come to our website, leave us a message, let me know what you think. Love to hear from you anytime. Thank you, and have a good day.